Hi everyone, welcome back. This is Dr. Grover and you can call me Sumit, licensed clinical psychologist of United States of America and of the United Kingdom. Firstly, thank you very much for throwing questions over me and giving me feedback for my last few recordings. Today's topic is as promised in my previous video and continuation of borderline personality disorders diagnosis part 1 is borderline personality disorder, which we can call BPD, powerful treatments used with case studies. Firstly, I would like to say that this video is not a substitute for clinical care. It is just for educational basis. Please follow the mental health protocols and seek support on the basis of your specific case. Being diagnosed with borderline personality disorder can be absolutely terrifying, especially with the patient and others thinking it is their fault, with the lack of emotional maturity and emotional intelligence leading to the desire to fall in love again and again and to have a consistent relationship. It is an illness, an issue which has treatment like other physical or mental illness or diseases, so it's not their fault. The intense emotional dysregulations, unstable relationships, unstable sense of self, and impulsive behavior makes many patients believe there's little hope for treatment. Also, a profound desire for genuine connection often gets overshadowed. For treatment, the patient and therapist have to collaborate against the borderline personality disorder symptoms. The first step of therapy is awareness. Awareness. With many of my patients, they say, Dr. Grover, I know what is happening with me. I know the pattern is repeating. It's going to repeat again. But it's so hard to stop and save myself. That is why I referred to the song Save Me From Me in my previous talk in part 1 of borderline personality disorder. But insight and awareness is a stage of therapy, not a goal. It leads to the next objective of therapy of pattern recognition. Pattern recognition is like, for example, in one of my case study of patient did develop certain pattern out of their insecurities and desire to have a genuine relationship, the desire to fall in love or make other person to fall in love. They fall in love quick, intense relationship, mistrust issue comes because of past experiences and rejections and abandonment, the acting out, impulsiveness with certain chaotic situations pushes the other person away, and the patient have to have more care and going through emotional pain gets into self-destructive behavior, which can lead to end of relationship too. They go into depressive phase for some time and come out of it and repeat the pattern again. So pattern recognition here helps at least to cause insight and awareness that yes, we need to cut this pattern and bring about changes. With the involvement of seductiveness, it complicates a little bit more. I treated a stripper who was a patient of borderline personality disorder. She mentioned to me that, Dr. Grover, it becomes so important for me to have one night stand with the person to lower my emotions of falling in love and achieving the person to have sense of approval and sense of accomplishment and sense of self, that I make a point to seduce, demand, and spend the night with the person. And I don't want to repeat this pattern again and again. I want to change my life to control my urge and desire of seducing. The patient was successfully treated and is living happily married and has kids, and has successfully retained and maintained a relationship for years together. On the basis of the etiology of borderline personality disorder, Dialectical Behavior Therapy, DBT, was developed by Marsha Linehan in 1993 to treat and to manage overwhelming emotions. Research shows that DBT strategies strengthen a person's ability to handle distress without losing control or acting destructively. Every individual has a certain level of threshold and skills known as distress tolerance skills. But some people, emotionally and physically, feel pain more in an intense way than others. And their distress comes on more quickly and feels like an overwhelming tidal wave. Because of emotional dysregulation and impulsive behavior and instability in relationship, the chaos prevailed in impulsive situation can lead to self-harming or suicide attempts. For example, urge of cutting. For many of the patients, as mentioned before, the self-harming is to make anguish known to others or revenge on partners. One of my patients made a pattern of self-harming and to visit the urgent care or ECMC and calling 911 again and again, because when asked, she said she needs someone else to demonstrate a caring act. Therefore, the urge to self-harm is very high. So technically, she is trying to testify and validate that who is going to rush to care for her. For this issue, the first distress tolerance skill is distracting yourself from the situation that is causing you emotional pain. Distraction skills are important as they can temporarily stop you from thinking about your pain and give you time to find an appropriate coping response. Out here, when we are going to talk about distraction, avoiding a distressful situation and not dealing with it is different than distracting. For distraction is to make use of 5 senses for calming skills and for distress tolerance skills, like the sense of touch, of holding ice in your hand, can stop the self-harming behavior of cutting and self-harming. The other senses, like auditory sense, by listening to calming music and meditation music, can distract and lead to calmness. The sense of olfactory works the best. Smelling a strong fragrance can lead to distraction and lower the intensity of the emotions. With most of my patients, the emotional pain and panic starts with rejection or failure to have an interpersonal relationship. It is very necessary to soothe yourself to regain the strength back. Self-soothing means to bring some amount of peace and relief from the pain. Increasing your ability to tolerate distress starts with changes your attitude and perspective towards a situation which has happened by accepting the situation as it is. And the concept of radical acceptance was introduced by Marsha Linehan in 1993. Radical acceptance is more of accepting the past because we cannot change the past. Even because if you're angry or upset, are you blaming someone to cause that pain and hurt? Unfortunately, whatever happens, whomsoever you blame for, the pain is not going to go away. It's going to exist. The radical acceptance coping statements like this situation won't last forever. I have survived other situations, similar situations like this before, and I will survive this one too. Rehearsing this statement million trillion times in a day can help for radical acceptance. But remember, radical accepting something doesn't mean that you give up and simply accept every bad situation that happens to you. Some situations in life are unjust, such as when someone abuses or assaults you. But for other situations in life, you share at least some responsibility. There's a balance between what you created and what others have created. Another strategy which comes in here of DBT is thought diffusion. Thought diffusion is a technique borrowed from acceptance and commitment therapy by Hayes, Stossel, and Wilson in 1999, which has been proven to be successful treatment for emotional distress. When distressing thoughts keep repeating, it's often easy to get hooked on them, like a fish biting on a bait hook. Diffusion requires the use of your imagination skills, your visualizing skills, your thought. You visualize your thoughts or pictures of words which have caused hurt. And without obsessing and analyzing them, you either imagine them sitting on a cloud and flying away, or only on a stream and floating the leaves away and bidding them goodbye. In my practice, once I was using a thought diffusion. One of my patients who has gone through domestic violence, she mentioned, Dr. Grover, it really worked with me back home. While putting a leaf on the stream and letting it pass away, I had put that man's picture, imagined it, who had given me hurt and violence, and I put my foot on the leaf and I drowned the picture. I said, okay, whatever works for you, right? So that's the way we can bid goodbye to the hurt and negative emotions. And because emotions and cognitive skills go hand in hand, higher the emotion, logics go down and don't work. That is why we say being blinded by anger or impulsiveness. That is where black and white thinking or all or nothing thinking with certain people and situations come in. Negative assumptions and being stuck on certain conflicting arguments, being inflexible, brings in escalation of negative emotions. Here is where the cognitive behavior therapies come along in with dialectical behavior therapy. So the CBT and the DBT work hand in hand as far as borderline personality disorder is concerned. The CBT model is negative thinking or assumptions about a certain situation, like everyone always treats me unfairly. An example of a negative thought leads to a negative feeling of hopelessness or anger, leading to a negative behavior of avoidance or self-harm. With cognitive behavior therapy, we can support the patient to change negative assumptions, but it will work surely if the emotions are regulated and impulsiveness is pacified. That is why mindfulness came into existence with dialectical behavior therapy. Mindfulness skills will help us to focus on one thing at a time in the present moment. And by doing this, you can better control and soothe your overwhelming emotions. Mindfulness helps to learn to identify and separate judgmental thoughts from your experience. These judgmental thoughts often lead to overwhelming emotions. Mindfulness consists of three stages: observe, describe, and participate. Observe means to be curious about what you feel, how you feel, without trying to make your feelings stronger. See how long you are feeling, how long it lasts, if it changes. Notice how feelings flow in out of your body waves. What comes through your senses: touch, smell, sight, sound, and taste. One of the good strategies of mindfulness skill is inner outer experience, and the other one band of light exercise, in which the person can sit and imagine a band of light like a halo light on the forehead, coming down slowly, breathing in a good way, and then coming up your body slowly. So you're observing the light, imagining, you're describing the sensations of tingling which is causing, and participating in causing your emotions to change to calmness. So inner outer experience is a strategy in which the person uses and observes its senses one after the other, but in between the observations come out and in again and again, and feels the presence and existence of the body, like noticing your weight of body on the chair, feelings of tingling on your skin, assuming the band of light rotating down from top to bottom. The other part of mindfulness is describe. Use the words to describe your experience. Use fact words. Thought is just thought, but not an action. Feeling is just a feeling. When we try to describe our experience mindfully, try to avoid using emotional words. Try to let go of your emotions about being right or about someone else being wrong while searching for words you describe. But remember, thoughts and feelings both can change. The other part is to participate. One needs to get lost in a healthy activity. Let go of your sense of time while you're doing something. Allow yourself to be natural in the situation. Participate your skills until they become a part of you. One of the common observations of the patients with borderline personality disorder, which I have researched with my patient, is especially with females, that I feel angry as I feel used. Observing the symptoms like sweating and cannot sleep. The description which she gives is that he uses me for sex, and then leading to a feeling of guilt and anger. The thought is that if I will not have sex with him, he will leave me. The insecurity and fear of abandonment comes in, which makes the patient or person to stay back with the man with patterns of impulsivity. But once the awareness is caused, being mindful and participating in therapy and practicing the skills till they become part of you. And a conclusion that this is not healthy thinking or relationship, patient opts for changes. So through CBT, the negative assumptions like nobody loves me or nobody wants to be with me or my happiness lies being with this man, thoughts can be changed to alternative balanced thoughts session after session. And the conclusion that I deserve love and my happiness does not lie in only being loved, but I have to direct my way with another direction to have happiness. So, in total, participation and participating in meditation mindfulness skills out here, two things are helping. The person changing of negative thoughts and assumptions, being mindful of the feelings and changing the feelings, leading to complete transformation of the person and patient and coming out of borderline personality disorder. Today we will end here. In the next part of borderline personality disorder treatment, we can talk about how to regulate our emotions and wise mind theory for rational mind and emotional mind balance to cause emotional intelligence and emotional maturity. Till then, have a good life, still fall in love, have a relationship, throw questions over me, and I will surely answer them. Below my page of the YouTube, you have my email ID. Things can be kept confidential. So have a good night, have a good day. Thank you for listening to me. It was a pleasure to do this piece of recording for you all. Have a good one.